The following portion of Daytime Tri-Cities is sponsored by Foundations Integrated Medical and Sports Health, home of Muncy Family Chiropractic. Well, this time of year, as we count our blessings, how thankful are you for good health? It's one of the most important things we can have, and maybe this is a good time to reevaluate and make some changes for better health. Dr. Todd Muncy with Foundations Integrated Medical and Sports Health has been with us throughout the year talking about good health, and this morning he is back with some good tips on a good foundation, and always good to have you back on the show.
Thank you. It's always a pleasure to be here. I love talking to your guests that are out here.
Well, and you always have some really great insight when it comes to just getting back to the core, and I know even through COVID and the pandemic, you really talked about why it's so important to have that good foundation. Absolutely.
You know, we got to have a good foundation of diet, exercise, function. You know, remember the function. We all forget that. You know, as chiropractors, in my profession, what we have found is that we're pigeonholed into being a pain doctor when there's so much more than that, so much more that the body can do, and we release that power to allow it to do it.
Well, and I think too in chiropractic, kind of like other physicians in medical care, people come see you when there's a problem.
Absolutely. Typically, the average person waits till they have a problem. They're in crisis care. They're in crisis mode. And that's where we're at in our society today. We're always waiting for the next crisis instead of trying to do something to prevent it. Doing preventative care is the best way to prevent a crisis in the first place.
And that's true when it comes to chiropractic.
Absolutely. I mean, if you will take care of yourself and think about function, if you will exercise, if you'll eat right, if you'll try to do the things to maintain a healthy spine and nerve system, you're going to be better off. And what we do as chiropractors is try to help you maintain that. We want to remove interference before it becomes your problem, before it becomes an issue. It's almost like changing the oil in your car to prevent from blowing the motor up.
Makes sense.
You want to do good maintenance so that you can have a healthy car.
And it kind of starts with chiropractic. I think people are really surprised when they tend to think of that. They think of, oh, well, somebody's hurt their back. But chiropractic is kind of connects everything else, keeps everything in line.
That's exactly what our mission is to affect that nerve system and allow that nerve system, which is the central, you know, portion of our body that helps us heal and correct everything. We try to influence that through the adjustments so that the body can react and start to do its job and heal itself.
And a lot of studies out there, and you've been doing kind of your own studies as well, that really tell us when we've got all of that working right, it can change everything else in our bodies.
That's right. When we change the function, we change the body. As a matter of fact, we were discussing earlier that I had applied for some research to start doing research on patients post-COVID, because what we had found with our post-COVID patients, they would come in and they would have a high pulse rate and a very low O2 after being in the hospital. We adjusted them, their pulse rate went down and their PO2 went up. So take, for instance, a patient has a 92 pulse ox. It means 92% absorption of oxygen in their blood and a pulse rate of 130. Well, after we adjusted them, we noticed that the pulse rate went down into the 100s and the pulse ox went up to like 96, 97. And as we continued to care, that started to separate even more to the good. It would get up to 99 and back down into the resting heart rate of the 60s. So we tested that on several patients throughout the office, even those who had not had COVID, and noticed a similar effect.
How surprised were you by those results?
Well, I was absolutely surprised. I wasn't surprised, but absolutely surprised, because I knew what chiropractic did worked, and I knew it worked, you know, without trying, but I didn't expect to see those results that fast. I didn't expect to see that, and when I called the research department and said, hey, I've got some research I want to do, they were surprised by that as well and said, we would like to participate in that. So now we're in the process of developing that research and getting it out there so that people can see it. You know, it's a blessing to a family member when they realize that, hey, my heart rate's going down, I don't have to be afraid that something bad's going to happen, and my pulse ox going up, and I can get off this oxygen that they've had me on.
It's a beautiful thing.
It is a beautiful thing.
And you said I'm surprised, but I'm not surprised, because you've known for years that it works, but to see those numbers and that quickly.
Yeah, to know that the human body can do what it's designed to do, given lack of interference, it's an amazing thing to watch. And yes, it was surprising, but not surprising.
Kind of that piece of the puzzle that's been missing. All right, well, certainly some great information, Dr. Muncy. Happy Thanksgiving to you.
Happy Thanksgiving to you.
Thanks for being a blessing here on our show, helping us all live that 100-year lifestyle. If you have questions or you would like more information, you can always check out their website. Some great tips and information at foundationsintegratedmedical.com, and you can stop by and see them on Moore Street in Bristol, Virginia. The preceding portion of Daytime Tri-Cities was sponsored by Foundations Integrated Medical and Sports Health, home of Muncy Family Chiropractic.